Hi, I'm Dr. Kody Chastain with Arkansas Physical Health and Rehab, and today I wanted to talk real quick about principal emergency treatment for acute sprain strains. Now, what does that mean? That means what you can do in the beginning when you have a sudden acute injury. And that injury could be as simple as I rolled my ankle with sports, or it could be something a little bit more severe, like a motor vehicle accident. Okay, now the gold standard has evolved, just like how we treat patients in our office. It keeps changing. In the beginning, you've probably heard it, the RICE protocol: rest, ice, compress, elevate. It was the gold standard. It didn't matter what you did. That's what you were supposed to do. Well, fast forward a little bit, and now it becomes the PRICE protocol. They added protecting. Protection can be something as simple as just crutches. Okay. Now the literature is starting to show we've evolved from PRICE and RICE to POLICE. Protect, again, crutches, optimal loading, getting people moving a little bit to where we prevent muscle stiffness, joint stiffness, atrophy of muscles even. Of course, ice, compression, which can be an ACE bandage, and elevation, which helps fluid return towards the heart. Again, it evolves. The new studies now have shown that, well, maybe we're doing things a little differently, and now we have peace and love. Peace is for your acute injury, the first 1 to 3 days, okay? Protect can still be crutches. Elevate, get the fluid returning back to the heart. Avoid anti-inflammatories. More and more studies are showing that taking anti-inflammatories early actually hinder our healing processes. Compress, same thing, still an ACE bandage. And educate. Go to your doctor. Get an understanding of how severe your sprain strain might become. And then after the 3 days, it becomes love. Whereas load, walking around gently stressing the joint. Optimism, having a good idea of what to expect with your outcomes depending on the grade of your strain sprain. Vascularization, promoting higher heart rate and blood flow, also pushes more fluid and healing factors into the area that's injured. And then lastly, exercise. And that can be strengthening exercises from passive range of motion to active range of motion to full-on strengthening exercises. Now, one thing that people always ask is why? Why is it changing? Why is now ice at the beginning no longer becoming an option? Well, it's because of the literature and the data that we have now. Another reason is, why do we load? Why do we recommend people do therapies for it? Is to take people from taking advantage of resting. In the past, people tend to rest too long. They take it too far. And with this protocol, after the 3 days, it lets people get up and moving and start laying down the fibers that need to be laid down so they don't become abnormal.